You have made it to the third trimester. Your bag's not packed, and the birth plan feels super overwhelming. And your toddler has no idea what is coming. Does this sound familiar? Well, today I am joined by Dr. Nellie Balfour. My name's Meg Faure, and in this episode, we are going to be tracking what is happening as Nellie approaches birth. We've been tracking Nellie, who's a paediatrician, all the way through since the first trimester, and now she's almost there. In this episode, Nellie and I get into everything that you need to know about birth, and particularly C-section births, because she is having an elective C-section. So she is actively preparing for birth right now. So here's what we cover. First of all, we talk about baby sensory personalities. We talk a little bit about whether or not you can actually tell what your baby's going to be by their movements in utero. It's a very interesting conversation. We also talk about what that sensory personality has in terms of impact on your older child. Her firstborn is a slow to warm up little one. And so we talk about how does slow to warm up little ones approach the birth of a new sibling? And what can you do to assist that? We also talk about the hospital bag. So I asked her to unpack her hospital bag with us. And she spoke about what is really needed, what you can leave at home. And I was fascinated by the type of sleepwear that she has chosen. And so if you're thinking about what type of sleepwear you should be packing, this is a very good one for you to hear about. And then we talked about those exact moments straight after birth. So what is an APGAR score? Why cord camping is important, and those very first moments, like what is a pediatrician doing in the room as your baby is born if you're having a C-section. So it was really, really interesting. This is a really warm and practical and very reassuring episode, and it's from a doctor who's actually living every single moment alongside you. So do tune in, don't go away, and share this with any mum you know who is pregnant, because it's a super useful episode. And of course, as always, please do go and subscribe to the podcast, because then you'll know whenever we have changes and new ones coming about. Welcome to Sense by Meg Faure, where we make sense of the science and art of parenting. Parenting is grey, gritty, and beautiful all at once. And my life's work as a healthcare professional is helping parents feel more confident in a season that can feel really overwhelming. In each episode, we share honest conversations with real mums, dive into the science with experts, and simply make sense of it all in practical ways. This is your space. You're not alone, you're held. So let's unpack the journey of a lifetime with sense. Right, so we are here with Nellie, and we are going to jump right in. Nellie, it's so lovely to have you with us today. How many weeks are you?
Thanks, Meg. I love being back. I love these sessions. I am 35 weeks and 3 days.
Oh my goodness, you are right into that last stretch now. How are you feeling?
I'm feeling good. I'm feeling ready to meet this little guy. I'm feeling tired, but weirdly enough, I have enough energy for all the nesting and all that fun stuff. I'm excited. I always get excited near the end of my pregnancies.
Well, that's wonderful. So the first trimester was really hectic because, first of all, I mean, you actually lost. I was quite amazed when I listened to the episode from last time that you really physically lost weight. You never think about that when people are that sick. And then your second trimester, you were glowing. So how would you encapture, what would you talk about when you talk about this third trimester?
Third trimester, I would say I am excited. I am anticipating the arrival of this little guy. I want to see how he looks. I want to see who he looks more like, me and my husband. I want to get a feel of his personality, even though we won't really get it, in the newborn phase, how he is compared to his brother, all of that stuff. There's been ups and downs, obviously, which we'll speak about too.
Yeah, absolutely. It is a very exciting phase. And I think, there was a psychologist who did a study many years ago and looked at what the focus is for parents, through each stage of pregnancy. And the focus at this stage of pregnancy is who is this little human? And it really is amazing. That's exactly what you're thinking about now. And obviously, how is he going to come out? Because those are probably the two big things that we are thinking about right now. Do you have a sense of how you're going to give birth?
Yes, so I'm having a cesarean section. I'm having an elective one. My firstborn was also born by elective cesarean section. So I know that there are lots of different opinions from moms and families about, how babies are born and which one's best, et cetera, et cetera. Just from my job as a pediatrician and seeing, babies born by both normal delivery and from cesarean section. Um, I don't think there's much of a difference. Obviously, there are studies that show different things about the microbiome, when you're born naturally, and the good and bad bacteria that coats the baby, which is good for the baby when it comes out vaginally. But then for me, I think that there's still the option of having an elective cesarean, meaning it is safe and it is something that is still on the table. So for me, I'm having an elective cesarean section for my second born and just like I had for my firstborn too.
Yeah, that's great. And I think you allude to something there, which sadly is what accompanies every single baby and placentas, that there's going to be opinions from all over the place for what is good, what is bad. And actually, it's such a personal journey. And so, yeah, I think that that's amazing. It does make for predictability. And so what dates are you going in? How are you taking it all the way to the bitter end, 40 weeks, or are you going to 38?
No, 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 38 weeks. So for elective cesareans, we generally do it at 38 weeks. You can push it to 39 if your gynecologist suggests for certain reasons. We usually never go up to 40 for elective. But yeah, 38 weeks and then he's here. And I always say it doesn't matter how your baby comes out, as long as you and your baby are safe, then that's all that really matters. And you're still a mom at the end of the day because you carried this little one for 9 months and you brought them into this world. So, yeah.
That's absolutely. Let's talk a little bit about his personality, because you said we're not going to know his personality straight after he's born, which of course is true. But we already have a few little indicators while they're in utero of what they're going to be like. How much more busy has he been, or less busy has he been than your firstborn?
Very busy. So my firstborn, I felt him kick often, obviously every day here and there. But this little guy is just like doing somersaults and tumbling around. He's a little acrobat. So I feel him very, very often every day throughout the day. So I think that might point towards how he could be different to his brother. I also know that firstborns and secondborns tend to differ quite a lot. Not just from my job, but from personal experience too. I mean, different families, even my family, there's three of us girls, and all three of us are very different. So, yeah, I think he's going to be quite a firecracker and he's going to be different from his brother too, but I can't wait to see.
Yeah, it's so interesting. So I have a theory. Definitely, this is just anecdotal. So I don't think there's any scientific evidence for this. But I think I do see that little ones who are very busy in utero are a little bit busier and sensory seekers afterwards. And I think that goes with their sensory personality. I love to think about little ones, the development of their personality based on the type of sensory information that they are engaging with and the way in which they engage with their world through their senses. So you get your sensory seekers, who I always call my social butterflies. And those little ones are very social. They're wired for interaction and they really like a lot of sensory input. And they tend to be quite exhausting babies and toddlers, I have to tell you, because they're just always looking for the stimulation. So, and it really does, I think when we understand our baby's sensory personality, it helps us to understand how to wean them and, how to get them to sleep in the early days. So it could be that he's going to be a busy little one, it sounds like.
It could be. And I was going to say, I love all of your work that you've done on sensory personalities. I actually watched a lot of your webinars with my firstborn when he was a newborn, like literally holding him and watching on the computer. And he's always been slow to warm. That's just how he's been. And he's been quite an easy baby and toddler. I mean, I can travel with him without thinking about, oh my God, is he going to wreak havoc? Is he going to throw a tantrum? Is he going to be running around all the time? He's quite calm because he's slow to warm and he just likes the people that he likes. But I do feel like maybe number two might be the social butterfly. So let's see. We'll find out.
I'd love to chat about that. So I have a slow to warm as well. So my firstborn was a social butterfly. My third was a slow to warm, and it's a very precious personality because they observe the world before they throw themselves in, and then once they're comfortable, they look like social butterflies. So they really are. It's a wonderful sensory personality, and it's so interesting, Nellie. When I was naming the 4 sensory personalities for one of my books, I called them settled, slow to warm up, social butterfly and sensitive. And somebody said to me along the way, they said, just those names are somewhat leading. It sounds like everybody should want a social butterfly because it's much nicer than a slow to warm, when you just look at the words. Well, having had both, I can tell you that those slow to warm up are very, very precious souls because they're observers and they really do. But once they're comfortable, they are an utter delight, center of the world. So, but what does happen, and this is quite an interesting thing, is that you obviously have this goodness of fit between your children, which will come up as well. And what's interesting is that with your slow to warm up little ones, their world does get disrupted quite significantly when anything new happens. And of course, the newness of a new baby, and particularly if it's a social butterfly who's very busy, is potentially going to be a little bit disruptive for your firstborn. And I think, it's kind of the little strategies that you can do, and I'm sure you're already doing them, of really talking through what's coming, preparing the room, and then showing him the room. Kind of talking about what's going to happen the next day, if you're going into hospital, or, and I think all of that verbal, because often our slow to warms tend to use their verbal intelligence quite strongly. They pattern their world intellectually, and then they're fine. Does that make sense for him?
No. It sounds exactly like him. And it's strange because I saw from early on that he was that type of baby who was slow to warm. And then now that he's 2 years and 2 months, I mean, I see it almost every day. So he is very observant and he watches people and his environment before he feels comfortable diving in. And then once he does feel comfortable, around the people and wherever he is, then that's when his personality really comes out. And he makes us laugh and he fascinates us and he's very interesting. But I do have my concerns about him and how he's going to adjust to his baby brother, because I do feel like his baby brother might be a social butterfly. Almost everyone in my family is a social butterfly. And then on my husband's side, almost everyone is slow to warm. So we'll see. Very interesting. So we'll see how it is, because he does get a little bit overwhelmed with other kids who are very out there and social and, kind of like happy and in your face and playing and fast and running around and all of that stuff. So yeah, I'm looking forward to seeing the dynamic and how things will be.
Yeah, very interesting. I think that what does make things a lot easier is when a parent does have insight, because you can then co-regulate for him and, and recognize, okay, he's becoming overstimulated. It's time to take him for a walk so that I can just settle the little one if the little one's a little bit colicky in the early days, and get that out the way, and then turn my full attention to him. So yeah, it is going to be a navigation. Is your husband with you, or is he, because I know you guys are kind of living between the Middle East and South Africa. So is he here now ready for the birth?
He's arriving tomorrow. So we're super, super excited. He is arriving tomorrow in preparation for the birth. And then my mother's also going to arrive in about a week and a half. So it's all very exciting. He will be here for the birth and he will be here afterwards for a significant amount of time too.
That's wonderful. So let's talk about the birth, because now we've started to think about this. We're into the last tranche last month. So have you, last 2 weeks actually. So tell us, what have you done to prepare? And I mean, have you packed the hospital bag? I saw something on your Instagram yesterday, so I'm interested by that.
Yes, hospital bag is packed. Especially for me, I'm still going to pack baby's bag next week because there's still a few things that I need. So hospital bag is packed for me, and I think for me, it's one of the most exciting parts about the end of the third trimester, because it's like, okay, it's really happening. We are prepared. If anything has to happen at any time of the day, we're ready to go. We just grab the bags. I remember in my first pregnancy, the bag was packed, and there was one day where I just was not feeling great and texted my gynae, and she was like, well, come into the hospital and bring your hospital bag. And then we were like, okay, this is what we've been waiting for. And we just grabbed the hospital bag and we went, and that was the day where I gave birth, even though it wasn't the scheduled C-section day. So yeah, I'm packed and it's exciting, and I've got all my favorite products and all the things that I need. And luckily, because I've done this before, I know exactly what I needed to put in the bag this time.
Brilliant. Well, let's go down that road. Tell me, what is in a hospital bag?
Okay, well, for me, for mom, A lot of my friends who give birth actually reach out to me to ask me this stuff too, because I'm a doctor and because I've given birth. And strangely enough, that when I gave birth for the first time, I reached out to a friend of mine just to double check that I had everything that I needed, even though, I'm meant to know this stuff. But in my hospital bag is obviously all of my maternity products that I would need. So I'm a huge fan of a range called Carrywell. They do maternity products. So they do stuff that you can have even before the birth and after the birth. So a lot of Carrywell products like linen savers for the hospital bed, maternity bras so I can breastfeed easily and just unclip, the usual maternity pads, maternity underwear to wear just after giving birth so that there's nothing that irritates my scar or my abdomen after the operation. There's a lot of Carol products that I have, which I absolutely adore. People also don't remember sometimes that they need to pack a phone charger so that their phone always stays on.
I wanted to ask you, just going back to the Carrywell products. I saw that there was a little, almost like a bulb with a pipe that points upwards. So it looks like something you'll fill up with water and kind of spray the area. Is that what that is? And tell us how you use that. What is it called?
So it is, and it's usually used for natural births. So you can use it for cesarean sections because just to clean yourself, but it's more for natural births because what it does is it's basically like a bottle and then it has a spout going up and pointing down. So if you hold it upside down, that spout kind of points upwards. And it's basically just for you to clean that area and to soothe the area after you give birth naturally. So, the vagina sometimes is usually like very painful. They suggest what we call sitz baths in the hospital, which is getting into a bath with certain ingredients and medications in the just to help with healing. That also assists with healing. So you can put sometimes cold water in there just to cool the area down or just to clean yourself. So that is one of the products that they have too. They have amazing products for every single type of birth and every single type of mom. I love all of their products.
Well, I mean, my son is 27. I'm showing my age, but he is 27, and I used all the Carrywell products when I gave birth. Those panties were just brilliant. So, okay, so we've got all of our little Carrywell products, and then we have got our phone charger, which is actually something that I think I probably would have forgotten. So that's important.
Yeah. Phone charger, breastfeeding pillow, because you actually realize how it's not that easy breastfeeding, the positioning. So if you haven't done it many times before, you need to find a very comfortable position, and that breastfeeding pillow really, really helps. In addition to that, slippers, because when you walk around, you want to keep your feet nice and warm. Some flip-flops for the shower, which a lot of people forget too, because it is a shared space in a hospital. So just for hygiene purposes, nightwear, which is better to buy in the form of a nightie, which is like a button down in the front versus actual pajamas with pants, especially if you're having a cesarean section, because, that elastic on the pajama pants may irritate the scar in the tummy, and it's going to be difficult to keep trying to take your pants on and off all the time, especially when you can't bend down or cough or do any of that stuff properly. So it's better just to have a nightie, and the buttons are for unbuttoning quickly to breastfeed and then buttoning up again. A gown is also a great idea. A breast pump if you want to express. Most of the time it is suggested just to try and help with the milk production. And then something which really came in handy for me the first time, which I happened to just put in my bag and I never really thought about it. It just happened to be there, but breast pads. So usually on the second or third day, your breast milk production just like immediately comes through, turns on like a tap. And you may leak. So it helps quite a bit to have those breast pads too, just to help with the leakage and all of that, especially in between feeds if your baby's sleeping. Yeah. So I think those are the things that I've packed in my
Are you
hospital
going to
bag.
take a speaker?
No. So I've seen some people suggest speakers, and I think that's an awesome idea, especially the ones who are giving birth naturally, because you can play music. Obviously, when you give birth in certain private hospitals, you have your own space in your own room. So you can play music while you give birth. For me, I'm not going to bring a speaker because I just enjoyed sleeping in between having baby with me. So I didn't really do much else. I didn't even bring like a laptop or iPad or anything to watch series or anything else because I know some people do that too. I just literally slept, and when I was awake, I was with my baby.
It's so interesting. It's actually a very different baby, maternity bag than it is if you are giving birth naturally. I mean, when I think back to my births, which were natural, it was very different. It was things like, all the things for labor. That was actually most of your focus. Kind of a third of your bag was for labor and two-thirds was for postnatal. In a C-section, what I'm hearing you say is it's actually a lot less around what happens in labor. It's very much more about, you know what's coming, and then it's all the comforts for afterwards.
Yeah, it's definitely the comforts for afterwards. So it's mostly postnatal when you have a C-section. Yeah, because obviously the C-section itself is 20 to 30 minutes and then you're back in your room. So it's not like you're laboring for hours and you need certain things in that room to keep you comfortable, to keep you sane, and all of that stuff. Yeah, it's very different.
And then for the little one, what have you packed in his baby bag?
So his baby bag, and this is my favorite part to actually pack because this has everything to do with my job also. I found it easier packing for him than I did for myself because this is something that I advise parents on very, very often. So obviously nappies, and I would suggest two sizes. There's the newborn size, which is sometimes I think it's about 1 to 3 kilos, and then there's the normal size one, which is 2 to 5 kilos. And the reason for this is because you don't really know how big your baby will be, and we don't want nappies that will be too big or too small for your little one. I mean, I know when we go for our ultrasounds, we usually get an estimated weight, but it's not always 100% correct. So there's nappies. There are wet wipes for baby. Usually we like them to be unscented, and free of certain products that might irritate baby's skin. There's cotton wool with surgical spirits that we need for the baby's belly button. Just a little umbilical stump just to help it heal nicely and not develop any infection every time you change the nappy. We would also like for baby to have outfits and beanies. So the reason for the beanies is because babies lose a lot of their heat from their heads because their heads are their biggest surface area on their body. And we also suggest swaddles as pediatricians because swaddles help keep the baby nice and contained and safe and comfortable. It basically gives the feeling of being back in the womb and it helps them sleep a little bit longer. We also sometimes suggest a pacifier or a dummy for the baby because just to help soothe them, that sucking motion sometimes when they can't be soothed, then it helps them sleep or calm down or drift off nicely. And I know that I needed that for my firstborn. Again, it was one of those things that I'd kind of thrown into the nappy bag and didn't think I would really use it, but I did need it in hospital.
Yeah, it's interesting. And again, there's just so many conflict. There's so much conflicting advice for parents on dummies. And I, like you, I'm a big fan of dummies and pacifiers. I think they're very good for little ones. What's quite interesting, and a lot of moms don't know this, is that when we're dealing with premature babies, we actually insist on them having a dummy because they need to develop their suck reflex nicely so they can start to breastfeed. So as opposed to being a problem for breastfeeding, dummies can be fine. The one caveat I would say is that in the early days, for comfort, when your baby does cry, prioritize the breast just because it helps your breast milk to establish nicely. And so I think the risk that comes with dummies is not so much around nipple confusion, as in this is what a nipple should feel like this is what a dummy feels like, but it's actually more around is a mom fobbing off a feed by giving their baby a dummy, which is what we don't want them to do. So feed regularly and use the dummy after the feed for non-nutritive sucking, which helps their little peristalsis through their gut.
Today's Dose of Sense is brought to you by ParentSense, the expert-based parenting app that gives you daily support from pregnancy to sleep, feeding, and daily routines. Take the guesswork out of parenting. Download ParentSense today and use the code SENSE50 for 50% off.
Feed regularly and use the dummy after the feed for non-nutritive sucking, which helps their little peristalsis through their gut.
Exactly. I 100% agree also. And then I think the last few things obviously are blankets for the baby. So we'd like blanket. As we know, we want a sleep safe environment for all babies. So sometimes loose blankets rather, can be dangerous. But if you wrap the baby in a blanket, they can be nice and warm. And then washing up and, moisturizers, that kind of stuff. Toiletries basically for your baby. So your baby will take its first bath in hospital. So something is needed to help, cleanse the baby. Something usually fragrance-free, foam-free, that type of stuff. Just so we don't dry out that very sensitive newborn skin. And then, some moisturizer usually just to help moisturize baby too. So I think that's it. And then obviously vests and all that warm stuff during this winter period is going to be really important. And this is my baby's going to be a winter baby. And today is absolutely freezing here in Johannesburg. It's 13 degrees. So I've yet to see how this winter's going to go. So we need to keep him nice and warm.
Yeah, absolutely. My firstborn was also a winter baby, and he was born on the night of a massive storm in Cape Town. So I know that feeling. I wanted to just go back to the washing them in hospital. I, with my firstborn, washed him in hospital and bathed him, and they showed me how to do a baby bath. And you couldn't actually be discharged back in those days unless you'd actually done your first bath. So they knew that you knew what to do when you got home. And I think I've never been more terrified in my whole life with that first baby bath. Like, oh my gosh, is he going to slip out my hands? Can I hold him? What happens when I lift him out? But actually, what's quite interesting is that there's also quite a bit of research that shows that not bathing your baby early is a good thing. It gives their skin time to absorb all the vernix. And there's some evidence that shows that babies who are not bathed immediately get their hands to their mouth sooner, because they've got this familiar taste of what the womb world tastes like. So I suppose the idea would be not to bath him within the first 3 days and just bath him the day before he leaves.
Yeah, so that's what we do at private hospitals. So all the private hospitals that I've worked at, and even the public hospitals I've worked at, on day 3 of life, that's when baby gets his first bath. So with my son, he got his first bath the day before we went home. So, I mean, it's awesome to see that these hospitals are following research and evidence-based medicine. So it's usually at 72 hours that baby gets his or her first bath.
Yeah, and talking about evidence-based medicine, delayed cord clamping, are they able to do that with C-sections? And can you just share with us a little bit why that would or wouldn't be a good idea?
No, we do. We do it with elective C-sections. And as far as possible, we try and do it even with emergency C-sections as long as baby is breathing. So delayed cord clamping, for those who don't know, is basically when the baby is born, obviously attached to the umbilical cord, which is attached to the placenta, which is attached to mom's blood flow. So we make sure that we don't clamp the cord within 30 to 60 seconds of the baby being out, so that we can try and get as much blood as possible from mom to baby, because there's huge benefits later on in life, including things like a lower risk of anemia and a lower risk of jaundice. Those are just two, just to give examples. So we do this in elective cesarean sections, and it's something that I wanted them to do with my firstborn, and they did, and I want them to do it again with my secondborn. And then in emergency cesarean sections, as long as it's safe to do so for baby, as long as baby is breathing and active, then we also promote delayed cord clamping. If there's any type of issue where baby needs oxygen or needs to be resuscitated, then absolutely not. We'll cut the cord and he could come straight to me as a pediatrician. But yeah, delayed cord clamping is something that we would like and we promote, and something that I would like to happen for my children too.
Yeah, absolutely. And then just talking about this through the sequence, those first split seconds after he's born. So he comes out, he delayed cord clamping. Does he then get put on immediately on your chest with a C-section, or does the pediatrician take him? How does that usually work?
So again, it depends on the baby and how things are looking. And it also depends on what you request. So there are moms who request that after the delayed cord clamping, baby is passed to them and put onto the chest. And that is done, and it's fine as long as baby is breathing and is healthy and is, nice and pink and everything is fine. That's completely okay. Then at that point, baby will go over to the pediatrician. Pediatrician checks baby out, and then baby can go right back to mom afterwards. So that's also great to put back onto your chest. If it is a situation in which baby's compromised in any way or isn't breathing and needs to be resuscitated, then we can't put baby onto mom's chest. But yeah, it does happen, especially if moms request it.
Okay, interesting. Now I'm going to spin everything around and I'm going to talk to you as a pediatrician. So you've obviously assisted at births. You've been in the C-section, in the labor room. Tell me exactly hundreds. So now a baby gets passed to you. What are you looking for? Why does a baby get passed to a pediatrician? Talk us through it.
The baby gets passed to a pediatrician so we can check baby out and make sure that everything is completely fine. And we basically examine the baby from head to toe. But there are things that we look out for as peds as soon as the baby comes out, just because we've been doing this for ages and we know what should and shouldn't happen. So we would like for baby to cry. It doesn't have to be a long, sustained cry. It can be a whimper here and there as long as the baby's breathing. And the reason we want baby to cry specifically is because crying tells us that there's oxygen going in and out of those little lungs, which is amazing. And obviously, the louder and longer the cry, the more oxygen we know that baby is taking in. After that, we look at the baby's color and movement, basically. So this is all just from observing and eyeing for the few seconds that the baby's out. So we expect baby to be blue at first or purplish, depending on the color of the skin. Usually after about 5 to 10 minutes, that's when we want the baby to be pink. So it's completely okay if the baby's blue. And a lot of the dads get a really big fright at seeing the baby for the first time because of the color of the baby. But we just have to reassure them that this is completely normal and it's fine. Later on, the baby will become pink, and it's fine if the hands and feet are still a little bit blue. Those will also get better later on too. We look at the activity of the baby. So is the baby nice and flexed or crying and the limbs are out? So we want the limbs to be, active. I wouldn't particularly say flex because sometimes if the limbs are out and the baby's crying, that's also fine too. The baby will flex the limbs when he or she feels a little bit more comfortable and warmer once they come over to us. So we don't want a floppy baby. We don't want a quiet baby. We don't want a baby that's blue for a long amount of time. Baby then gets passed to us after being shown to mom and dad quickly, just to, let them know that this is your brand new bundle of joy. And then that's when we examine the baby. So we basically look at a whole lot of different things from head to toe, shape of the head, look of the face, anything that's abnormal. We look at the neck. We examine the chest. We listen to the heart. We make sure that the breath sounds good, the heart sounds good. We look at the little abdomen with the umbilical stump at that point. We look at the baby's legs, if they are nice and flexed at that point, because they should be, at the baby's back, at the hands and toes, 10, just to make sure everything is fine. We look at the anus, at the vagina or the penis, just to make sure genitalia are okay. So because we've been doing this for quite a while, it's quite a quick exam because we know what to look at and what to expect. And then once we're happy with everything, then we hand the baby right back to mom and dad, and then they can be with their newborn. So that's basically what they're doing with us during that time.
Very interesting. Obviously, do you rank the APGAR or does the nurse rank the APGAR?
It's us, it's the pediatricians who do the APGAR. Pediatricians are present at every single cesarean section, whether it's elective or emergency. So we'll do the APGAR. If it's a natural delivery with no complications, then the nurse who's there will do the APGAR. So that's basically just scoring the baby out of 10. And it gives us an indication using a lot of different parameters, which is appearance, breathing, activity, the baby's color, the heart rate. The score out of 10 basically lets us know whether we are happy with the baby and everything will be fine versus whether the baby needs a little bit more attention, more oxygen, needs to go to ICU, needs to be attended to and paid attention to a little closely. It basically just lets us know the prognosis, if you will, of how baby will be from now onwards.
And what's very interesting, I remember when I first learned about APGARs, which was obviously when I was at university as an OT, because, an APGAR, a very low APGAR, can indicate problems later on. So if I was seeing a cerebral palsy child, they often will have had a very low APGAR. But what I was really interested about was that if it was 7 and 10, it's not 7 out of 10. It is 7 at 1 minute and 10 at 5 minutes. And so mums, what's quite interesting is that you can have a fairly low first number, which let's say 5. And if your second number is 10, everybody is like, this is absolutely like perfect. But if you have even a high number of, let's say, 6, and a second number is also 6, that is a lot more worrying, because then they're not actually picking up. Am I correct, Nellie?
100%. It's the 5-minute APGAR that actually counts for more than the 1-minute APGAR. So your 1-minute APGAR can be 5, and then your 5-minute APGAR can be 8, and we're happy. It's okay. So that's basically what we tend to look at. And then obviously there's a 10-minute APGAR, which if it was 8 at 5 minutes, at 10 minutes should be higher, etc. But yeah, it's the 5-minute APGAR that's more important.
Excellent. Very, very interesting. Wow. I must say, and I think mums, 90% of mums who've just heard the APGAR conversation probably didn't even know about that. And I do think that one of the difficulties and challenges that you have as a pediatrician is that you know so much. And so going into birth for you becomes something that takes a different lens, because you know exactly what happens at this process. And you also have seen things go wrong, but you've also seen, obviously, by far the majority go right. So I can imagine your anxiety might rise a little bit over the next 2 weeks. And we are going to wish you lots of love and a wonderful birth and delivery. And those first beautiful moments with your baby. I really do wish those to be beautiful for you, Nellie.
Thank you so much, Meg. I really appreciate it. I'm looking forward to it. And you will hear when he has arrived on planet Earth. I'll let you know.
Definitely. And we'll definitely regroup within 2 weeks after he's born. I'll give you a little bit of time and space just to regroup. And then we would love to touch base again so we can hear about what the birth actually went like and exactly what happened. So good luck, Nellie.
Absolutely. Thank you so much, Meg.
Thank you for joining me today. I hope today's conversation brought you a little more clarity, calm, and confidence on your parenting journey. If you enjoyed the episode, please do share it with a friend who needs to hear it today. And also go and subscribe to the podcast so you never miss out on an episode. I'll be back next week with another episode, same time, same place, and always here to support you. And in the meantime, download the ParentSense app to take the guesswork out of feeding, sleep, weaning, routines, and everything in between.